So I'd like to welcome all those viewing this presentation, the first of a new series called The Power of Pivoting, Managing Through Crisis. A series of interviews with key HSS personnel, individuals who have been involved in our response to the COVID-19 threat to our city and beyond. This effort was initiated by members of our HSS Education Institute, who are developing a wide-ranging and interesting roster of topics relevant to the challenges of the current medical environment. Now, I am Dr. Ronald Mackenzie, an internist and rheumatologist at Special Surgery and professor of clinical medicine and medical ethics at Weill Cornell Medicine. Now, by way of introduction, the Hospital for Special Surgery has responded to the pandemic in unprecedented ways, which include the suspension of all non-essential services, pivoting where possible to a model of virtual care, triaging all orthopedic trauma patients to our institution, and perhaps most transformational, adapting our inpatient services to the care of non-orthopedic COVID-19 patients, even those with critical and life-threatening complications of that condition. In so doing, our orthopedic and rheumatic disease hospital has virtually transmuted itself to meet the extraordinary demands and challenges of the pandemic, an effort directed by leaders of our institution, two of whom are joining me today. So let me introduce Dr. Bryan Kelly, our Surgeon-in-Chief and Medical Director for the Hospital for Special Surgery. Bryan's an international authority in sports medicine. He also serves more locally as head team physician for the New York Rangers and an associate team physician for the New York Giants. And he has consultant roles with other major sports-related organizations as well. He also holds a position, a faculty position at the New York Presbyterian Weill Cornell Medicine. In addition, Steve Forti is a very recent addition to HSS leadership. I think it was April 1st, so less than 2 weeks. And he holds the title, a new position called Chief of Staff, Crisis Management, a new role at HSS concerning which you'll learn more shortly. He has a fascinating background, very unique. He's both he has extensive experience in nursing and trauma and critical care, and served for over 20 years in the armed forces, earning the rank of Master Sergeant in the Army Special Service. In that capacity, he served as a Special Forces Weapons Sergeant, Special Forces Intel Sergeant, and he is a Level 1 sniper with training at the Defense Intelligence Agency. So welcome to you both. While I prepared a number of questions as anchors for the discussion, let me first start with Bryan, who is also less than a year into his leadership position at the hospital, and say, I don't think this was the job you signed up for.
No, it was not in the original job description, for sure.
So, gentlemen, what have been some of the biggest challenges for the staff in transforming our specialty hospital into a facility for critical care patients with a threatening infectious disease?
So I'll start with that. I mean, I think you outlined it very well. The Hospital for Special Surgery has a 157-year history of being one of the world's leading musculoskeletal and orthopedic care providers. We've had the ranking of the #1 orthopedic hospital in the world for the last 10 years, and we have spent all of our time really focused on managing and treating complex musculoskeletal injuries, focusing on orthopedics and rheumatic diseases. And it's a very specific subspecialization, and all of the clinical care providers, whether it's the medical staff, nursing staff, physician assistants, physical therapists, radiology technicians, and really the entire infrastructure of the institution has been built up to really focus on managing these specific types of patients. And so the ability or the decision to transmute, as you said, the institution into a hospital that can care for a completely different type of patient population is a huge Herculean task. And I think our ability to do it has really been a testament to the types of people that form the foundation of the institution at its core, the culture, the ability to work collaboratively as a team, and recognizing that it's really our obligation under these extreme circumstances to serve the community as best we can, given the resources that we have available to us. Having said that, the obstacles that we've faced and have been required to overcome have been tremendous because we had to stop all essential orthopedic surgery, reducing our typical day from doing 130 to 140 orthopedic surgeries a day to doing less than 10 to 15. We had to transform our critical care capacity from a 5-unit ICU to a 30-unit ICU, all with the same staff that we had for our typical hospital. We've had to ask the nurses and the frontline staff to care for patients with really complicated medical conditions that they hadn't been taking care of in the past because we typically take care of relatively healthy orthopedic patients. And really everybody's been asked to do things that are far outside of their comfort zone and not necessarily within their level of experience, but everyone stepped up to do it in a tremendous fashion.
So, Bryan, tell us then a little bit about the decision to bring Steve on, or an individual with Steve's background in this setting, and maybe Steve could then fill us in a little bit about himself and his thoughts about the role.
Yeah, I think it was probably about 2.5 weeks ago, as the leadership started to picture what the hospital was being transformed into. We realized that there were going to be a lot of things that were going to be happening at the hospital that were going to significantly increase stress and anxiety levels of the people who were working here, particularly the clinical frontline staff. We are fortunate as an institution to take care of relatively healthy people and are not typically accustomed to people who end up dying or expiring from some of the conditions that we're currently seeing. And the stress associated with that, I felt was really important that we had somebody who had a background and experience in crisis, was experienced in his ability to really help the frontline staff understand what their role was and try to help us motivate the people here to do all of the things that they were going to be asked to do. And I thought having somebody like Steve involved in this crisis was going to be really critical for our ability to do what we need to do, but also to maintain the morale and help us deal with situations involved in crisis that we aren't typically having to deal with. So Steve was asked to come on and help us with those types of things.
And I think to add to that, one of the amazing things about this institution is when the conversations began 2.5 weeks ago, I got to speak to the majority of the executive level staff. First of all, I've never found an institution to be so concerned about their employees and an institution so willing to do whatever was required above and beyond what the norm would be. So when we had the initial conversations, I was almost immediately sold on the brand of HSS, because if there's a fight going on in the world, and there is, you have an institution that's throwing every single thing they can at it for the protection of the employees, whether you're talking about the actual physical protection from the COVID virus, but then the emotional support required. As Dr. Kelly has mentioned, you have sort of an acuity and a training mismatch. And I've seen that in the past in the military, where that's a stressful situation. Okay, you have a individual, and across the board, the staff, I can't say it enough, is extraordinary, with this unbelievable desire to serve amidst this crisis, to do a meaningful part. And here they are in this position where, because of their specialty, they're somewhat training ill-equipped to handle it at that given time as it was coming. So they've stepped up in this extraordinary fashion and began to train and learn and become equipped to handle a complete transformation of this hospital into one that's going to be caring for these critically ill patients. So when I was asked to come on board, I saw the executive level staff so concerned about it. It was something that I immediately wanted to be a part of and to take part of. Most of the guys in the military, after 2 decades at war, have an interesting perspective on these things. And while we've never been here before with the pandemic like this and with a threat and an enemy like this, in a way I say air quote, we've been here before. We've been in dynamic environments where it's changing on a day-to-day basis. We've been in environments where there's an imminent threat, and we've been able to coach and lead and navigate our way through that for over 2 decades. So my experience as an ICU nurse, my experience with the military, I think we thought was a good fit to throw that additional layer of protection onto our employees.
I would say that it's almost a paradoxical problem because the staff is so great at what they do. They're the best in the world at taking care of a specific subset of patients. That's the bar that they set for themselves. And I think the acuity technical mismatch that Steve's talking about is one of the things that challenges the staff the most. They are comfortable being the best, and then they're thrown into an environment where they're not only not necessarily the best, they are not experienced in something. We're asking them to go in and do the same thing for patients as they've done in the past, but do it with a completely different subset of patients without the necessary clinical tools that they would typically have when they're taking care of the standard patients that we are. And so to try to adjust their comfort level and say, you're not going to feel comfortable, you have to get comfortable feeling uncomfortable, but these patients have a much better chance here with you than they do somewhere else or in no hospital at all. And I've heard Steve say that probably half a dozen times over the course of the last 10 days, where we really have to try to reset the staff's comfort level where it's not going to feel as normal. It's not going to feel as comfortable. You're not going to feel as expert as you have in the past, but that's okay. And trying to get them emotionally equipped for that is a hurdle for us, but it's also a benefit for the patients. And what I've seen over the course of 1 week is our frontline staff now have become more accustomed to taking care of these patients. And compared to some of the other hospitals around, I feel like we're providing as good or better care for these patients as they're getting other institutions because of how great they are at baseline, but also because of how much they care about being the best at what they do.
Bryan, I thought it was a really unique decision to make in that you could have chosen, for instance, a psychologist. There's a number of ways you could have gone if the point was to provide a certain type of kind of secure environment and for the staff. So maybe both of you could tackle this next question, but based on your observations, what are the best strategies, or what are you finding to be the best strategies for supporting the staff?
So I would say I was sold on Steve after one telephone call, the first telephone call that I had with him, when I asked a simple question: how am I as a leader of the institution? How do I motivate or even personally feel comfortable asking our frontline people, our frontline medical staff, to do something that they feel ill-equipped to do? And he, within half a second, answered very clearly, if not now, then when? If not us, then who? And he said, that's what you say, that's what you tell them. And to me, that was such a meaningful way to think about it. If not now, then when? If not us, then who? And I think that for me has been the underlying motivation throughout this whole thing. That it's our responsibility, it's our obligation, it's our ethical duty to make sure that we're doing everything we can to help out in this crisis. And although they may feel ill-equipped because they don't have the experience, we are their best chance. We're the best chance to try to help these patients.
So, Steve, how do you go about actually imparting those concepts to the staff? What's your day like, for instance?
All right, well, we'll start with, so my days, we're still figuring out what that is actually. It's dynamic and it's changing constantly, which is fine. I think that's the same issue that everybody in the hospital is facing with. The only thing that's consistent is inconsistency at this point. We try to make ourselves available, myself and the entire crisis management team at all levels makes yourself available to staff from floor to floor. Asking the questions: do you have the equipment? Are you safe? What do you need? What are the resources? And that goes a long way. And when you have somebody like the chief executive of this hospital doing the same thing on a Saturday, that's the kind of leadership that I find extraordinary and didn't expect to see outside of the military. That's commonplace in special operations. You see that. You see a colonel or somebody of a higher rank than you even want being there out on patrol and meeting with the masses. but to see it here at the hospitals really impactful for me. From Jen O'Neill, the chief nursing officer, to chief medical, to see the orthopedic surgeons who are otherwise without a job jumping in a new role and lending a hand. It's an amazing thing to be a part of. So what we do is we spend our day trying to keep the inertia and the momentum of that feeling throughout the hospital. I think the easiest way to convey it to the staff is to accurately point out how important they are, okay? This is likely the largest thing that we're gonna face as a generation. And people could compare it to 9/11, and they could compare it to 20 years at war. They can compare it to a lot of things. But as a nation, I hear at the homeland, this is the largest thing that we're gonna face, okay? Across the board, from paramedics and firemen who are going to the homes, to the individuals here on the front lines that are fighting tooth and nail on little sleep to deliver the care. This is our battle as a nation, and this is the battle that's going to forge this nation in a unique way in which it's never been forged before. I think one of the issues is we live in a world where I don't know that any of us actually feels that important. I don't think anybody feels that impactful. So reminding them accurately that the lives, in particular here, to speak to HSS, to remind them accurately that the bed that you are caring for, the patient in that bed, is freeing another bed up somewhere for someone else to receive excellent care. And if you view it from that lens where every single person, from the security guy at the front door to the person pushing a stretcher, every single person matters here at HSS, arguably more than they ever will, in terms of a criticality, in terms of a life and death. So when you point that out to them, they get it and they feel it. And they're stepping up already in this role. But I think it allows them to step up more effectively. I've seen extraordinary things at this hospital, and I could go on for hours about it, but I hope that answers your question.
Yeah.
So the only other thing I would add is and this is something that Steve and I have talked about a little bit, and it's something to the extent that at some point in the future, whether it's a year from now or 2 years from now, there'll be a story that's told about how HSS and the individuals at HSS responded to this crisis. And we want to make sure that that story is something that's worth telling and something that we're proud about. And the other thing that Steve and I have talked about is that this is an opportunity for us to transform ourselves, not just as an institution, but as individuals. And how we respond in this situation, what we do, how we do it, and how we play our role in it is going to change us as individuals on the other side of it. And it can change us in a good way or it can change us in a bad way. And I think if everybody dives in and experiences the power of that Steve just talked about, the power of our ability to care for these people and be impactful in the world and for the community and for this crisis, we will come out on the other side changed. And if we don't, we'll also come out changed, but we'll come out changed in a worse way. And so I think this is an opportunity for us to transform ourselves individually.
So I have another question. This condition has befallen our society in a very different information age than anything before, and has the almost real-time availability of knowledge, whether it's good or bad, been a help or a hindrance to the development of the best practices at our institution?
Yeah, I mean, I think, information is power, and the more information we have, the better. The challenge in this particular pandemic or this particular crisis is that the information changes literally on an hour-to-hour basis. And because of the speed at which the pandemic has come over us and the obstacles, there's been 3 specific obstacles that we've faced, and they've been, the constant problems, and it's shortages of PPE, shortages of testing, and shortages of ventilators. And so the constant changing information that we have about this, what kind of virus is this? Is it an airborne virus or a droplet virus? What kind of PPE do we need? What's the availability of testing? What are the antibody testings? What types of treatments are available? Should we be using hydrochloroquine? Is there a use or a role for convalescent plasma? These are things that there's lots of opinions about it. And the constant and ubiquitous availability of that information to the public, to the patients, and frankly, to the medical staff and to the frontline workers here, gives everyone an opinion or allows everybody to have an opinion. And the opinion is based upon incomplete facts. And so it's challenging because we're trying to make policies that will protect our priorities, which are our patients, our staff, our institution, our community. And it does allow for the potential that there's people who maybe have an opinion that we should be doing something differently than we are, or they read something somewhere that they want us to implement. And that's challenging. It's no different, as we talked about earlier, Ron, as patients who come in who have surfed the internet on their particular condition want to manage their treatment plan for something, but have incomplete information. So I think it's great to have this availability of knowledge, but it's challenging because it's incomplete information.
The early identification of the need for a single source of truth is something that this place has done very well. So when you have top-down communication, you're constantly fighting the rumor mill, the I heard, right? And the I heard is very detrimental down at the front lines where people are fighting this. I thought we were supposed to do this. You referenced PPE. I read on the CDC guidelines. Why are we doing more? Why are we doing less? And the constant flux of that information, even if it's a flex up, where you're providing more protection, can actually be detrimental information-wise because people are scared of change or inconsistency or the credibility of information. So I think one of those things that we've discussed so many times is establishing that single source of truth, where if you want information, here's where you go for it. And HSS is very good at that in that they have an app to provide those informations. They have live streams to provide that information. They have sessions just like this to provide those pieces of information. So I think that's a huge takeaway and a lesson learned from this experience.
We all recognize what a fast-moving disease this is, and it's descended on our city in almost breathtaking fashion. Knowing what you now know, are there things that you might have done differently a week or two ago?
Yeah, I think in Monday morning quarterback, hindsight's 2020. There's lots of ways to try to look back and wonder if you should rewrite the script. I would say that starting 4 weeks ago, which is when we first made the decision to stop all essential surgery, we were ahead of the curve. We were doing that. We made that decision before almost all of the other hospitals in the New York City area before they made that decision. And at the time, the question was always, well, are we overreacting to this? The knee-jerk reaction, do we really need to do this much? And I remember talking to Lou at one point early on in this process, and we both agreed that if we look back on this 3 or 4 months from now or 6 months from now, and we're criticized because we overreacted and we had a better outcome than we underreacted and had a worse outcome, we'd rather be criticized for overreacting. The problem is we never overreacted, and it always seemed like we were doing more, but we maybe could have done 2 steps more than we were even doing. And it's just very challenging with the information and the timing and the quickness that things are moving forward. You feel like you're doing absolutely the most aggressive thing possible to try to make decisions that will combat the virus. But in retrospect, we could have probably socially isolated everyone earlier. We probably could have stopped doing essential surgeries a week or 2 before that. We just didn't have the information around to make that feel like that was a possibility. And even the decisions that we were making seemed aggressive at the time. And the ability to socialize those decisions and get buy-in on those decisions really requires understanding what the environment looks like. And the environment has changed more rapidly than we thought. I think we've been as aggressive as possible, but in hindsight, you could argue, well, we could have probably even done more or could have done something sooner, but I don't think the environment would have allowed us to do it.
Slightly saddened that Dr. Kelly didn't say brought me on earlier since I've only been here for 2 weeks. It's a tough lens for me. I bring a different perspective to it because I came here right in the middle of the fight and without commenting on the epidemiological side of things, which I don't have much of a say on compared to the expertise in this place. I think as a nation, we could have been better prepared for the emotional impact of all of this. we got incredibly comfortable in our lack of change. We got incredibly comfortable on the way things are. And I think as a nation, there was a lot of questions that were immediately brought up when these things about social isolation started coming up. But we've adapted and we've done well with it.
Do you have any recommendations for other organizations based on our experience of the last few weeks? And are there, you think, mechanisms in place where to more broadly communicate those lessons learned?
Yeah, I mean, I think, I think Lou Shapiro has done an amazing job at navigating this crisis as our CEO. And, immediately when we started making these transitions toward the transmutation of the hospital into what it currently is today, he put processes in place for communication through live streams, daily emails, videos to communicate as transparently and regularly as possible that I personally wouldn't necessarily have thought of as being important. And I would say they've been absolutely critical for our ability to make sure that the staff feels like they are part of the decisions. I do spend a lot of my day now in meetings. I spend a lot of my day going around the hospital, and I try to go to every floor every day and talk to as many people as possible to get a pulse of what's going on in the institution. I feel like I'm trying to, get the entire soul of the institution into my brain so I understand what's going on in every corner of the hospital. And when I talk to the people, the constant feedback that I get is that they're very, very appreciative of the communication, the transparency. And I would say my advice to another institution is make sure that you're not making decisions in a vacuum, because people want to know the why as to the reasoning behind decisions. And if you're not communicating that why, then it's a much more challenging environment to work in.
One of the things I want to make sure I point out here is they talked about bringing me in on this role, which is a piece of the puzzle, and it's a small piece in my opinion. Laura Robbins, the crisis management team, have done an extraordinary job of putting other resources in place. So when they looked at the unknowns, like what was going to be required, they took the approach where they put a lot of resources behind it. So the mental welfare and the stress reduction for the frontline workers, and they put in virtual outreach ability for every employer. They put in technology pieces to get outreach when they're feeling stress. They did constant meetings with frontline managers and senior executives to always know that the employers are being taken care of and to have all the resources available for their well-being. And I don't think that's something you could start early enough. And they did it early. And I think it's paid incredible dividends. The other thing that I've seen here that's worked very well is it's never too late in the game to revisit the plan. And the plan is constantly being changed, it's constantly being reformatted, but in a formal way so that the goals and the objectives and the outcomes are meaningful.
So can we come out of this experience a stronger institution?
Well, I think I alluded to that earlier. I think this is almost a blessing. This is an opportunity for HSS to do things in a really, really contracted period of time that otherwise may have taken us years to accomplish. I think that the transformation of the culture into one that is built on what the foundation was, but has completely magnified how great the culture is and how important it is for the group to work collaboratively and as a team is something that we were forced to do under the auspices of this pandemic. And although we do have an amazing culture, this has really forced us to bind together. There have also been literally probably half a dozen to a dozen other things that we've been able to accomplish even during the crisis management portion of this period, which the implementation of telemedicine, on March 15th, which was the day before we started making a lot of these changes, we had 0 telemedicine visits that were being done on a daily basis. And today we're up to around 500 telemedicine visits a day, which is going to transform the way that we interact with patients. The way that we've consolidated some of the satellites to serve as urgent orthopedic care clinics, and we've changed schedules. Actually, many of the changes that we've made that we were forced to make because of the pandemic are things that we may continue to utilize going forward because they are more efficient and they're better ways for patients to access our healthcare system. the digital offerings that we've provided for our patients so that we can continue to communicate to our patients and make sure that they know that we're still available for them, even in the setting of this pandemic, is really something that's been incredible and something that's going to serve us positively on the other side of this. So I think that not only are we going to get through this, I think that we will be a stronger, more united organization as a result of this, and I think it's going to serve HSS very well going forward.
The innovation and the grit that I've seen displayed at this hospital is representative of this country in a crisis. There's no doubt in my mind that on the other side of this, HSS will be a better institution for it.
Gentlemen, thank you very much for your time and your efforts on behalf of the hospital staff, the patients, indeed, really the people of New York City. So in closing, this is the first of a series of discussions concerning the HSS response to the COVID-19 crisis. For those of you who are interested, there'll be a listing of future programs appearing on the HSS website